Hello and welcome. Today we're diving into a condition affecting the urinary system called neurogenic bladder. This complex disorder disrupts the normal function of the bladder, impacting a person's ability to store and release urine. Understanding its causes, symptoms, and management is crucial for improving the quality of life for those affected. Neurogenic bladder arises from damage to the nervous system, which controls bladder function. The precise causes are diverse. Common culprits include spinal cord injuries, such as those resulting from accidents or trauma. Conditions like multiple sclerosis and Parkinson's disease can also disrupt nerve signals to the bladder. Other potential causes involve stroke, brain tumors, diabetic neuropathy, and even certain birth defects like spina bifida. Essentially, anything that interrupts the communication pathway between the brain, spinal cord, and bladder can lead to neurogenic bladder. To understand neurogenic bladder, we need to look at the normal urination process. The bladder fills with urine, and stretch receptors send signals to the brain, signaling the need to urinate. The brain then sends signals back to the bladder, telling the detrusor muscle to contract and the sphincters to relax, allowing urine to flow. In neurogenic bladder, this process is disrupted. Depending on the location and extent of the nerve damage, the bladder might become overactive, leading to frequent and uncontrolled urination. Alternatively, it might become underactive, struggling to empty completely, causing urine retention and potential complications. Determining the precise epidemiology of neurogenic bladder is challenging, as it's often a secondary condition related to other underlying neurological disorders. Because of this, there are no standardized epidemiological data specifically for neurogenic bladder. The frequency with which it occurs is closely tied to the prevalence of the conditions that cause it, such as spinal cord injuries, multiple sclerosis, and diabetes. Consequently, the incidence of the associated neurological disorders can be used to estimate the potential population at risk for developing neurogenic bladder. The signs and symptoms of neurogenic bladder vary depending on the type and severity of nerve damage. Common symptoms include frequent urination, sometimes as often as every hour. Urgency, or a sudden, compelling need to urinate, is also common. Urinary incontinence, or the involuntary leakage of urine, is another frequent symptom. Conversely, some individuals experience difficulty initiating urination, a weak urine stream, or the feeling that they haven't completely emptied their bladder. Incomplete bladder emptying can lead to recurrent urinary tract infections, a key warning sign of neurogenic bladder. Diagnosing neurogenic bladder involves a comprehensive evaluation. The process typically starts with a detailed medical history and a physical examination. A urinalysis is performed to check for infection or other abnormalities. Aerodynamic testing is a key component, measuring bladder capacity, pressure, and flow rates during filling and emptying. Imaging studies, such as ultrasound or cystoscopy, may be used to visualize the bladder and urinary tract. A neurological assessment is performed to determine the cause of the condition. Neurogenic bladder isn't a single entity, but can be categorized based on the type of bladder dysfunction. One common classification involves distinguishing between spastic or overactive bladder and flaccid or underactive bladder. Spastic bladder is characterized by involuntary bladder contractions, leading to frequent urination and incontinence. Flaccid bladder, on the other hand, is marked by an inability to contract properly, leading to urine retention. Another important distinction is between upper motor neuron and lower motor neuron lesions, based on the location of nerve damage. These classifications guide treatment strategies. The management of neurogenic bladder focuses on managing symptoms, preventing complications, and improving quality of life. Treatment approaches vary based on the type of bladder dysfunction. For overactive bladder, medications like anticholinergics can help reduce bladder contractions. Intermittent catheterization, where a catheter is inserted periodically to drain the bladder, is often used for underactive bladder. In some cases, surgery may be necessary to improve bladder emptying or control incontinence. Lifestyle modifications, such as fluid management and timed voiding, also play a role. Regular monitoring and follow-up are essential to prevent complications like urinary tract infections and kidney damage. Preventing neurogenic bladder often centers on preventing the underlying conditions that cause it. Practicing safety measures to avoid spinal cord injuries, such as wearing seat belts and helmets, is critical. Managing chronic conditions like diabetes with proper diet and medication can help prevent nerve damage. Early detection and treatment of neurological disorders can also help minimize the risk of developing neurogenic bladder. While not all cases are preventable, proactive measures can significantly reduce the risk. The prognosis for individuals with neurogenic bladder varies significantly depending on the underlying cause, severity of nerve damage, and the effectiveness of treatment. With appropriate management, many individuals can achieve improved bladder control and a better quality of life. However, lifelong management is often necessary. Recent research focuses on developing more effective medications, advanced neuromodulation techniques, and regenerative therapies to restore bladder function. Ongoing clinical trials are exploring promising new approaches to improve the long-term outcomes for those living with neurogenic bladder.